Amen. Do not resuscitate. Let's say you're a patient in the hospital and you have a painful, debilitating terminal disease. You have declined to the point where you can no longer feed yourself, walk, dress and bathe yourself, and you're incontinent, meaning that you urinate and defecate on yourself and have to be cleaned. If to not go through or to continue or perpetuate that state, it is best that you sign a DNR. You can save your family from the heartache of having to difficult decisions. I think everyone should make their own decision, whether they do or don't, and inform your family so that they'll know in the instance of having or going through cardiac arrest or your breathing stopping that you either want CPR or you don't. As a nurse, I see families grapple with that painful decision regularly. So let's talk about some reasons why you should have a DNR to save your family from that pain. First, the CPR versus DNR. CPR is the cardiopulmonary resuscitation, and that means that consists of chest compressions and breath to restart your heart and start you back to breathing. Now, some benefits of that would be if you were a healthy person and you went through a situation like that, it could it could help to restore your life and restore you back to normal health. But if not, it could make conditions worse. The risk of having CPR are sore chest, broken ribs, collapsed lungs. Who and then also they could wind up being worse off than they were before. According to Dr. Ackerman with the American Family Physicians, he says that less than 10% of patients even survive such an ordeal, and those that do are worse off than they were before. Now, a DNR is a form that is a legal form that you sign and have with two witnesses present, and then your doctor, if you are still competent, which states that you want a DNR. This form follows you in your medical records should you be transferred to the hospital or transferred from one hospital to another. This form is also can be completed if you're incompetent and doctors deem that a DNR is necessary. It just will take two doctors instead of one to sign it and make it legal. The benefits of having to choose or having a choice of when you die is that you can decide to should you have this illness or disease and your life is at that point where you have no quality of life, you're just existing. Should your heart stop or if you stop breathing, you can choose to just have a natural death, or you can choose to have the CPR, but then you have those risks that go along with it of injury, of worse conditions, of prolonging the inevitable. So the CPR may save you, but at what cost? Now, some misconceptions about DNRs are that once you have a DNR fine, then your treatment stops, and that's not true. DNR is only about should an emergency arise where your heart stops and you stop breathing. It has nothing to do with the current treatment. Your treatment will remain the same. So in conclusion, if you are in a position where if you are in a position where you know that you have a terminal disease and you may not be, you have a terminal disease that there's not a good prognosis of, when the social worker comes to you and asks you to sign a DNR, sign it. Sign it. It'll save you some dignity and some and not prolong any pain and embarrassment you may endure with going through this disease process, and also to save your family. Thank you.